My name is Dr. Cody McClatchey. I am the current board chair of the Medical Association of Atlanta and co-founder of Piedmont Internal Medicine, where I practice today. I have served on the executive committee and health and policy committee of the Georgia chapter of the American College of Physicians, the board of directors of the Piedmont Clinic, Piedmont Medical Care Corporation, and Piedmont Healthcare Foundation in Atlanta, the board and executive committee of Medical Association of Atlanta, and board of directors of the Medical Association of Georgia. Our webinar today targets both physicians and patients. We are talking about cancer. Cancer is the state of Georgia's second leading killer, but today we're going to speak more specifically about colorectal cancer. All of us can read the headlines about colorectal cancer, the cancer quietly killing people. Cancer rates are rising in young people, but how worried should we be? Are some articles that have come out in the last day. I'm here with Lynn Durham, President and CEO of Georgia Center for Oncology Research and Education, which is Georgia CORE, a nonprofit working to strengthen the fight against cancer, the state of Georgia's second leading killer. Georgia CORE works to increase access to resources, research, personalized cancer care, and support for patients, survivors, and caregivers. We hope this webinar can help physicians point primary care patients to additional resources, and we hope any patients that see this understand the importance of getting screenings. Lynn, thank you for being here today. Can you introduce yourself and share a bit of your background?
Sure. Thank you so much, Dr. McClatchey. I'm very happy to be here. I am Lynn Durham, President and CEO, as you said, of Georgia CORE. We are a statewide nonprofit that works to strengthen cancer care through research, education, and advocacy. So we work throughout the state, but we are located right here in Atlanta. I spent most of my career in higher education and government relations at Georgia Tech. I was there over 20 years, and then came over to Georgia CORE during the pandemic, right at the height of it. I walked in with one employee, to be honest. Everyone had retired, and the pandemic had done its thing, but we have rebuilt, and it's a fantastic organization. But I am also a cancer survivor, so I got to be involved in Georgia CORE because of the survivorship advisory board that we had at that time. And they asked me to serve, and really just became engrossed in the mission of this place and what we do. So as a three-time cancer survivor, I feel very strongly about all Georgians having access to cancer screenings and cancer care, and work every day to make that possible. Lastly, I received my doctorate in education from UGA, and I am the mother of 26-year-old twins.
All right. Well, we're here today to discuss increasing awareness in the physician community as well as the public about your efforts to promote colorectal cancer screenings. Can you start by talking more broadly about the work of Georgia CORE?
Sure. So Georgia CORE was founded back in 2003 by Governor Roy Barnes, actually, when all the states started receiving tobacco settlement funds. So when those big tobacco was sued and the state started receiving money, which the state still receives to this day. Georgia CORE was founded to bring more cancer clinical trials to Georgian. The governor didn't want any Georgian to feel like they had to leave the state for quality cancer care. And so we came and filled that gap. Since that time, we've broadened what we do. We work in many other areas of cancer other than just clinical research, but that still is a huge area of focus for us. We work to make sure that Georgians outside of Atlanta also have access to cancer clinical trials and to other cancer services. We work with doctors and other providers, with healthcare organizations, with lawmakers, with navigators, cancer patient navigators, and survivors and others. So we aren't directly patient facing. We're generally working with the leaders of organizations to try to improve cancer care in that way. We have 3 large federal grants, and one of those focuses on colorectal cancer, and that's how we got so involved in colorectal cancer. It is from the CDC, Centers for Disease Control and Prevention, and what we're trying to do is increase colorectal cancer screening rates in Southeast and Southwest Georgia. But that became something that we really felt passionate about, and we wanted to work throughout the state, not just in those areas, although there's still those areas, their screening rates are much lower than other areas in Georgia, and so we wanted to concentrate on those. But we are grateful that we've been working with federal and state partners and to really raise awareness of this particular disease because it is a very dangerous killer.
Within that work, let's talk about your efforts to fight colorectal cancer specifically. We can all read the headlines about rise-in rates. Can you talk a bit more about those data points so our viewers get a sense of why these upticks are important?
Yeah, absolutely. You mentioned that colon cancer is actually the second leading cancer cause of death in the nation right now for both men and women combined. And unfortunately, we are finding, not we, but medical professionals are finding more screening because screening has increased. And so we're finding more cancers early. However, that's for people 45 and up. And so we're really decided we wanted a campaign that really spoke to all Georgians about the signs and symptoms, but particularly those 25 to 45 who are experiencing higher rates. Each year, it's increasing by 1 to 2 percentage points of the number of young people, people under the screening age who are being diagnosed with colorectal cancer. So we decided that we really wanted to do more with that. The American Cancer Society and their facts and figures document every year, released every year, shows that over 6,000 Georgians are expected to be diagnosed with colorectal cancer this year, and about 1,600 are expected to die. And so this is something facing our state, and we want to make sure that people know about that. Another interesting fact is that according to the National Center for Biotechnology Information, between 25 and 35% of people who are undergoing treatment for colorectal cancer have a family history of colorectal cancer. So we want to make sure people are having conversations with their families and know what their medical history is. We all know that the U.S. Preventive Services Task Force and the ACS, American Cancer Society, have lowered the screening age to 45. That happened, I think, about 3 years ago. And so we are going lower, and that's great, but we're still not catching, of course, all the cancers. But we encourage all non-symptomatic people who are 45 and up to get their cancer screenings. In Georgia, our rate is pretty good. We're in the 70% of people who should be getting their colorectal cancer screening that do. So that's great. The goal is at least 80%, but we're climbing toward that. But because of the statistics I gave at the beginning of this about people under 50 being diagnosed at increasing rates, we need people to be aware of the symptoms. And so we want them to talk to their doctors and for their doctors to order colonoscopies when warranted and to rule out colorectal cancer. Quickly, I just tell you, I have a friend who was 37 years old, had just had a baby a year before. She was having rectal bleeding. She didn't know what was happening. She went to her doctor, and her doctor, helpful, but he said, you know, you're young, you're healthy, it's probably hemorrhoids from your baby. And so didn't order a colonoscopy at that time. She came back months later and she had stage 3B rectal cancer. It could have been just hemorrhoids, absolutely. But we really want doctors and members of MAA to hopefully order that colonoscopy and make sure that patients come in with those symptoms, that they're being seen and tested.
Now let's talk a bit more about your campaign. What inspired it and how has the response been so far?
Sure. So it's called Weird Looking Stools, and if you don't mind, I'm going to share a picture very quickly so people can see what those stools look like. And there it is. There are 3 of the 5 stools that we have. And so these were developed by an artist named Julian Scalia. What we asked is that we wanted a conversation piece. We wanted people to walk into a restaurant or bar or coffee shop, see a stool and say, what is that? And then go read the signage. You see at the top of the picture, there's a sign there. There's a coffee cup because we will have coffee sleeves around coffee cups with the signs and symptoms of colorectal cancer. We'll also have coasters in bars so people can see those. So there are 2 additional stools that they're designed a little bit differently, but we want them to be conversation pieces. And as I said, we're really targeting people 25 to 45 and where they hang out, where they go, where they talk to people, where they congregate. And coffee shops and bars are top of those lists. And so we thought this would be a really unique way to bring art into the conversation, to bring to make people, it's a little edgy, it's a little funny, it's a little odd, but maybe make those conversations start happening in bars and coffee shops. And if not, that they go home and they're thinking about it. On each sign and coaster and coffee sleeve, there is a QR code, so they can go to our website, which is called weirdlookingstools.com. And that's where you get more information, really understanding what the signs and symptoms are, what actions you should take if you have any. If you're not having any, but you're 45 and over, what you need to do to go get screened if you have not been screened already. So it gives a lot of information on the campaign itself, but also on just the actions that people need to take to do this, to check on their own health. So we launched on September 15th, and we have had about 15,000 people already look at our website, which we're thrilled with. There are billboards. Somebody told me today they were driving down I-20 and saw one of the weird looking stool billboards. There's a lot on social media. We're trying to really push this on social media. And I'll tell you what's been so great is to see so many survivors have reached out to us and thanked us and said how incredibly creative this is. And they were so excited about it. So it is having the impact that we want. We've actually even had 2 other states contact us and say, hey, can we have your stools when you're done? And we're like, no, we're probably going to auction those off so we can get more money to do more awareness campaigns. But we are really happy with the response that we've received thus far from the campaign.
So now that the campaign is out there and attracting attention, what do you need from practicing physicians to help your efforts?
Oh, thank you. That's the most important question of the day, and I appreciate that. We really want to make sure practicing physicians know that more people may be coming into your office and asking about screening and asking about testing if they're having symptoms. We wanted to make practicing physicians aware that this is something people are seeing, and they may come into your office and mention it or ask about it or ask for a screening test if they haven't had one and they're of age, or tell you they're having some symptoms that they didn't realize could be colorectal cancer. So we want physicians to be aware of that. We hope this campaign does 3 things. We want to educate the public about colorectal cancer. We certainly want to encourage people who have symptoms to see their doctor and to get a plan of what they're going to do. And then we also want asymptomatic people to be screened. So we just wanted you to know that you may see an uptick in people who are asking about this. And lastly, you probably already do this, but to encourage your patients to talk to their family about their family history. I know with colorectal cancer, if your grandfather was diagnosed at age 50 with colorectal cancer, then you probably need to start getting screened at 40 instead of 45. So just making sure that patients understand their responsibility. Thanksgiving's coming up, not a great topic around the table. We understand that colorectal cancer, but it's good to have those conversations. So that's what we're trying to do with physicians to make sure you're aware.
Well, I think I'll take this opportunity to just share some of my perspectives on this.
Please do. Absolutely.
I'm a general internist, so I basically am trained to care for all adults, and there is an increasing incidence of colorectal cancer at younger ages than we had previously been screening for. I've been practicing 25 years, and I have never had a patient get diagnosed with colon cancer who had properly screened for it. That's pretty impressive. You can't say that about many screening tests. I mean, certainly not mammograms
Mhm.
for breast cancer.
Yeah.
Um, the other thing I think that's important for people to know is that there are a lot of different effective ways to screen for colon cancer, and they're not necessarily expensive or invasive. I still recommend, I tell my patients that I think the best test is to get a colonoscopy at a frequency interval that's based on their risk factors. If your average risk, it's every 10 years. If you have risk factors, though, it's more often, usually every 5 years. But if you're somebody who doesn't want to do a colonoscopy, the stool testing is very effective. And the Cologuard test, I order that, and then the order goes electronically to the company that makes the test, and then they ship it to the patient's house. And then the patient puts a stool sample in a container and mails it back, and then I get the results usually within a week. So, and if that's a normal test, then you're considered to be at low risk for getting colon cancer for another 3 years, and you just keep repeating that every 3 years, and you can change which tests you do. But and for people who that's about $600, and if you don't have insurance, or if you have an insurance policy with a high deductible, annual fecal immunochemistry testing or FIT testing of a fecal sample is actually quite effective and very easy to do. It just requires putting a stool sample on a card and then mailing it back to the lab. So this is an easy thing to do. I've always been surprised at how many people don't do it. I happen to practice, in an urban area where people, have employment, have employer-provided health insurance, probably at a greater rate than rural areas of the state. And so they tend to be more compliant about getting things like this done. Because cost is not as much of an issue.
Yeah.
And frankly, I'm more available. There's a shortage of doctors in rural areas. So a lot of people really just use the ER or urgent care clinics to get a lot of their care that are in rural areas, at least in primary care.
They do, yes.
So it's just, there's more barriers for getting the recommended screening tests for all cancers, but including colon cancer in underserved areas like rural Georgia. I've been on the clinical governance committee for the primary care section of the Piedmont Clinic for a number of years. I retired from that recently, but I served on that for about 4 years. And one of the things that we're trying to do is just improve the quality of care throughout the Piedmont system, which is statewide. And one of the quality metrics that we watch closely is what percentage of our patients have been adequately screened for colorectal cancer.
Great.
It's amazing how low the numbers can be. And we've really improved our numbers over time because we've really worked at it. I think our system goal is 80%, which I think is what you mentioned as a goal. And many of the clinics have surpassed that, but in some of the more rural areas or underserved areas, the system's still working hard to reach that goal. But think about what that really means. I mean, that means that if you meet the goal of 80%, that means 20% of people out there aren't getting screened.
Yeah.
A lot of people.
Right.
It has 8 million people in it. And so not all of them are, over 25 years old, but that's a lot. That's hundreds of thousands of people who are exposing themselves to the risk of getting colon cancer. So it's an affordable test.
Yeah.
An easy test to perform. And if done properly, it's extremely unlikely that you're going to get colon cancer. And I'll tell you what, I've probably seen in 25 years, maybe 2 or 3 cases of colon cancer. It's one of the most sad things to watch. It's not the way you want to die. I'll put it that way.
No.
And I do want to emphasize the fact that it has a rising incidence in people that are younger. I mean, the current guidelines are to screen everybody no later than age 45.
Yeah.
If you have risk factors, the screening should start 10 years before the age of a first-degree relative being diagnosed with it. So, I mean, I do have some patients, who have like a dad who got it at age 40, so I'm starting at age 30. Colonoscopies. I mean, that's sort of the extreme example. But I'll give you a case that I actually had. I was about 5 years into my practice, and I had a patient who was probably in his early to mid 30s at the time, and no risk factors for colon cancer. He came for his annual physical with me, and he said he had noticed some red blood in his stool on a number of occasions
Mm.
in the past few months. And so I referred him to a colorectal surgeon to get his hemorrhoids fixed. And he had hemorrhoids, and they were fixed.
Mm-hmm.
And his colorectal surgeon, and I even saw this written in his note, said, if the bleeding continues, I need to see you back. And the bleeding did continue, and he never went back. And
Oh,
uh, about, I don't know, I guess it was his next physical, it was the next year. He came back to me, and he was still having blood in his stool. And I was like, listen, you got to go back to your colorectal surgeon.
yeah.
Got to do a colonoscopy now. So he did a colonoscopy, and he had rectal cancer. So, and it was pretty high up in the rectum. So that's why you might miss it if you're just stopping at the level of the hemorrhoids. So
Yeah.
that really taught me a lot. Now he ended up having trying to think now. I think it was stage 3 rectal cancer, but it was cured. He's still my
Oh, wow. That's
it
amazing.
is 20 years later. But
That's great.
it was scary. And so that just to give you an example of how young patients can get it and how you have to really be vigilant about pursuing symptoms if they're not fully explained by hemorrhoids.
Yeah. Thank you for sharing that. I absolutely, and I actually had a woman I met through, there's a national group called Fight Colorectal Cancer, and they advocate on the Hill for more cancer, colon cancer research funding and other things. And I met her going to Capitol Hill, and she was advocating. She was diagnosed at 36, and she just died 2 months ago. And her name was Sarah. She was from Woodstock, Georgia. And I get teary whenever I mention her name. And she left 4 children behind. And it just is very difficult to watch, like you said, to watch someone die of colon cancer is very, very difficult. And she had no idea because she was adopted. She had no idea if she had a family history or not. But thank you for sharing your story. That is fantastic that he's still doing well. And that's not always the case with stage 3 and 4 cancers, but that's why we want to catch them really early.
Right. Well, as you know, the Medical Association of Atlanta is a physician association with a focus on advocating for patients and for the profession. We have our Medical Association of Georgia House of Delegates meeting coming up. It would be great to hear about some of the advocacy work that the cancer community is doing at the Capitol so that our members can see potential areas in which we align. I think with more attention on your campaign and the work you are doing, there are definitely ways that the MAA and Georgia Core can work together to make progress on cancer care in Georgia. Before we go to final remarks, can you point out some locations that those in the Atlanta area can see your campaign in action?
Sure, I'm happy to tell you that. And if you have just a second, I'd love to tell you about some of our what we're working on at the state capitol, just so people are aware of those efforts. But on the stools themselves, yes, we have them right now in Atlanta, Athens, Macon, and Valdosta. In Atlanta, we have them at Fido Irish Pub at both the Midtown and the Buckhead locations. We have them at Black Coffee in Lakewood, Atlantic Grill at Atlantic Station, and Park Bar, where we held our launch down by State Farm Arena, and they have them there. And then Casa Balam in Decatur. We're trying to get some up in Alpharetta right now, so we're hoping to move to Alpharetta and Roswell and other areas. But then we're going to be moving them around the state to Savannah, Augusta, Gainesville, Albany, different areas of the state. So we're happy about that. But please, if you see one, take your picture with it, post a selfie, and get the conversation started. But on our advocacy work, we would love to work with MAA on any kind of cancer legislation or advocacy. We had a very successful session last year. We advocated for funding for this campaign, the Weird Looking Stools campaign. And then they gave us $250,000 to fund this, which we are incredibly grateful for. And so that was successful. But then then also we asked for a committee to be formed on cancer care access throughout the state. We know that there are major gaps in not just funding, but what we can do to help with screening and prevention and early detection. And then also what we can do to recruit and retain physicians in our state. We all know that there is an issue. There's a problem with physicians coming to Georgia and staying in Georgia, especially in our rural areas, but also beyond physicians, our nurses, our navigators, our clinical research coordinators, and others, our APPs. So we're trying to make sure that legislators hear us and know that there is a problem and there is a gap, and we want to pay attention to that. So we are looking at that. We're waiting on the report to come from that committee right now. They met 3 times over the summer, and we're expecting that report any day now that will give their recommendations for the next legislative session. So we'll know more about what we will be asking for once that report comes out. But the things we know we'll ask for, an increase in the tobacco tax. We know that smoking causes or certainly exacerbates many cancers, and we want to make sure Georgia has the lowest smoking rate we can have. We have right now a tobacco tax of only 37 cents on the dollar and for each pack, and we're the second lowest in the country. Missouri is the only state lower than we are, and we have got to do more to increase the tobacco tax and to get more funding that can go towards smoking cessation and other prevention efforts. And then also vaping. Vaping is a bigger issue. It's coming bigger every year. We know these vaping companies are trying to attract minors. There is no doubt. And so we want to increase the tax on vaping to make sure that that is a deterrent, but also they are talking right now about completely getting rid of all the flavored vaping products. There's so many flavored products that kids are very attracted to. And so trying to make sure that the state of Georgia doesn't allow that, so we can protect our kids especially, but also adults from vaping. We don't know what carcinogens are in all those other than formaldehyde and a few other things, and they haven't been around long enough to do long-term tests on what it causes for cancer, but we know it's horrible for your health. And so those are 2 areas that we will continue to pay attention to as the legislature comes around next January.
All right. Well, we would like to thank the audience for tuning in, and thank you, Lynn. Thank you so much for your time.
Absolutely.
We will include resources from Georgia Core in the show notes. This was the latest Medical Association of Atlanta webinar. See you next time.